Question is that the amendment be disagreed to, and I call the member for Dunkley.
Thank you, Deputy Speaker. There's no doubt that the COVID pandemic has affected not just Australia but countries around the world in many ways, in addition to the death and serious illness that it's caused. And as many people have spoken about in this chamber before me, one of the impacts has been on global supply chains and medicine supply. And Australia hasn't been immune to that. But this is another example of a government that's been in office for 8 years, and has failed in that time to put in place plans, to put in place procedures, to think about how they would react to things like global pandemics that might affect supply chains. So whilst it's terrific that things are being addressed now and this bill has some measures that will go towards access to medicines when there's been a disruption on supply chains, it's pretty rich, I have to say, for members of the government to come in here and pat themselves on the back about what a great job they've done during this global pandemic. You know, how they had to get involved at the last minute to help to stop shortages of medicines, about how this legislation will make changes when it's reactive, not proactive, when issues with supply chains were known before the pandemic and they didn't do anything about it, when local manufacturing of medicines has needed government support and hasn't got it in the 8 long years of this government. You know, we know that there are 263 medicines listed by the TGA that are experiencing shortages in Australia, and another 54 are anticipated. Not all of that could have been prevented had this government had an actual plan for how to deal with the consequences of a global pandemic, but some of it could have been. Some of it could have been. And shortages of medicines including cardiovascular disease, diabetes, epilepsy, high cholesterol, severe pain, mental health conditions such as depression, bipolar disorder and schizophrenia. These are not conditions where people should be left wondering how they're going to fill their next script. These are not conditions where it's okay if you miss your medication for a little while. You know, I had a constituent, Ms Cameron, contact my office on behalf of her husband because he couldn't get Actemra medication to treat his giant cell arteriitis. Now, and we tried our best to help. We made inquiries with the local pharmacists at Peninsula Health, and they said, yep, there's a global shortage of it. 4 weeks Ms Cameron spent trying to get her husband his medication. It took the help of my office, calling pharmacies, contacting the supplier directly before she could get a month's worth of supply. And that was only because someone hadn't turned up at the pharmacist to get their supply, and it leaves you wondering what happened to that person. You know, how is it that Australians have to go to such great lengths to obtain medication? And I've written to the minister on Ms Cameron and her husband's behalf, acknowledging, of course, the global shortages that I've spoken about. But what is the Morrison government doing to ensure the supply of Actemra increases? Because she can't do this every month. You know, she's not going to be so lucky that every month somebody forgets to go or can't go and collect their script so she can get one for her husband. You know, or is it the case that the government does expect her to go through that process to get that medication every month? So, as I say, while the provisions in this bill are welcome, it is a shame that it's reactionary after people have experienced the consequences of not being able to access medicines, not being able to pay for medicines and the global supply chain shortages, and not before. You know? And it's why it's really important to have vision like Labor's proposal for a reconstruction fund to support manufacturing, to diverse manufacturing, and to manufacture medicines as we come out of COVID. You know, $15 billion in a reconstruction fund to strengthen and diversify Australian manufacturing, including the manufacture of medicines. That's the sort of policy that this country needs. You know, delivering an mRNA vaccine manufacturing capacity in Australia, actually delivering it, not talking about it. You know, something that the government, the Morrison government, promised long ago but is yet to deliver. That's the sort of delivery and vision, not announcement, that this country needs and needs desperately and would be provided by a federal Labor government. I want to also talk about one example that my colleague, the member for Cowan, talked about just before me, and my colleague, the member for Macarthur, who's sitting next to me, tabled a petition in respect of recently. And that's a drug that's not yet on the PBS, but would help families with loved ones suffering from cystic fibrosis, and that's Trikafta. Now, the member for Cowan spoke about the drug, because it's not listed on the PBS, costing something like $300,000 a year for people to access. And as she said, she doesn't know anyone who could pay that. I certainly don't know anyone in my electorate that could pay that much money. But I know people who would sell everything that they owned to be able to get that much money, if only they could, to make the lives of their children who suffer from cystic fibrosis better. They shouldn't have to. You know, Rachel from Frankston South is one of those people who's waiting for Trikafta to be listed for her son. He struggles to breathe every day, and not surprisingly, she lived in ongoing fear about COVID-19 and what would happen if he was to catch it, even with vaccinations. This is what Rachel, I apologise, I think it's Rochelle, emailed to me. Cystic fibrosis is an awful disease to live with. Its symptoms are often very difficult to manage. I have learnt not to expect miracles, but I certainly do still expect fairness. But now it's clear that in this latest round, following PBAC applications, we will receive neither. The miracle is right there, just out of reach, because Vertex and the government were unable to come to an agreement. My family will suffer, other families will suffer, some may even lose the ones they love. Individuals cannot afford Trikafta on their own. We need help. But it is a cutting-edge medicine with proven effectiveness. Trikafta improves lung function, decreases exacerbations and improves weight gain for an overwhelming majority of CF patients. There is no substitute. There is nothing that can offer the same hope, the same lease on life. She emailed to me, please use your power to help make the powers that be reconsider Trikafta. There is always something that can be done, always a proposition to be made or an angle to be explored. Please step up the pressure and hopefully your efforts will bring both parties to the negotiation table. In the meantime, CF Australians need compassionate access to Trikafta so that lives and life years can be saved while the negotiations are dragging on. I am one person, says Rochelle, but there are many more like me, and we are all standing up to be counted. Please stand with us and don't let the government give up on us by giving up on Trikafta. Yours in help, parents of a child with CF, Rochelle and her husband. So today I am standing up with Rochelle and all the other constituents who have contacted me on behalf of their loved ones to support them and to put Rochelle's words before the Parliament about what Trikafta could do if only it was affordable and accessible, and lend my support to their campaign for the government to get that negotiation done and get it listed on the PBS. Thank you, Deputy Speaker.